It is my distinct honor and privilege to be here today. Thank you so much for inviting me. It's very heartwarming. I have incredibly fond memories of being here, and I'm going to share a little bit of those stories with you. As I was asked to present today, one of the first thoughts was, what could I bring to the table to talk about bold leadership that might be a little bit different? And I don't think, as was mentioned, there's a lot on the internet about leadership, so I looked into my own heart. And what I think about in bold leadership is authenticity and taking risk. So we're going to talk a little bit, I'm going to talk a little bit about what that means to me. So to take you back just a bit, I graduated from high school at Osseo. I was just right over here. In fact, Mr. Tessman, I do believe you know my stepfather, Don Peterson. Yes, there we go. Okay, yes. He spoke very highly of you. He's up in the Brainerd Lakes area now. So anyway, I graduated from high school, and I was 17. I was a little young when I graduated, and I came right here to North Hennepin. I had an opportunity to go to the University of Minnesota, but I lived on 81st in Georgia. It was really close, and the University of Minnesota, when I was 17, seemed daunting at best. So I came here, and it was warm, and it was inviting. My class, my nursing class, was a mixture of people who were picking nursing as a second career for them. And in fact, one of my classmates is here. Is Matt still around? Oh, there he is. Thank you. I was so delighted to see you today. That was amazing. And then those of us who were children, really, coming into nursing school. So I went through school here, and it is a very highly regarded program. We got to bond as classmates, and we kind of navigated through the process. My very first job out of nursing school was at Fairview, which was formerly called Fairview Riverside. So it's just right downtown. And I was hired, and my first day on the job, I was considered a graduate nurse at the time because I had taken my boards but not gotten my board results because it took a little longer then to do it. Not quite as many computers around. So anyway, my job was, while they were doing the morning report, I was dispatched out to do vital signs, blood pressure, temperatures, all that kind of stuff. So I'm happily doing that because I feel very confident in doing vitals. I know how to do that. So I'm going bed to bed to bed, meeting people, because I'm a little bit extroverted, so I chat and stuff like this. I come up to this one woman, and she's sleeping, and so I gently try to wake her up, and uh-oh, she's not waking up. So I have to problem solve this, and fast. So I draw on my education that I've had, my experiences here, and I hit the code button, which is the alarm that brings in all the emergency staff that are necessary when something is drastically wrong. I knew I needed to do that because I had been educated on how to problem solve and how to do things well. Now, at that point, I stepped back because I am not experienced enough to handle a code. Give me about 2 more years, and I'm running those codes. But at this point, I'm not doing that yet. And the team runs in, and my heart is pounding, but I've done the right thing. And I've done the right thing because I've been well-educated, and I've been supported, and I know how to move forward. So let's fast forward a little bit. Now I am working in Philadelphia. I have moved from here to Philadelphia, and I'm working for a large insurance company. And I have a team of people who are across the country, and I'm in the process of building provider contracts. So I'm in the insurance business, and I'm negotiating contracts. And in this, I have one employee in particular who's working out of Florida, and she's kind of running our call center. Wonderful woman. So she has a situation that happens in her family, and the situation is that her husband's family business is in Santo Domingo, and he has to go home in order to be with the family business. And so I'm thinking, why can't she do it from Santo Domingo? I mean, she's doing it from Florida anyway. Why not? Let's take a risk. So we do that. Myrna goes down to Santo Domingo, and she runs the call center from there. She flies in periodically as she needs to. One time when I'm on the phone with Myrna, though, and we're trying to do something online, and Myrna, what is going on? Because things weren't quite working properly. Well, evidently, internet service is a bit variable in Santo Domingo at that time, and she was crawling under the American Airlines club desk trying to find an outlet in which she could actually connect for internet service. Now, I have a picture in my mind of Myrna because I have never, ever seen Myrna without pearls and high heels, and she is under the desk in the American Airlines trying to find an internet service. Clearly, this risk that I took was good in some ways, but in other ways, it didn't quite work out. So she did come back, partly because her husband's family didn't need him any longer, and she was able to re-engage with the company stateside. But sometimes you have to take a risk in order to learn something. And in that case, I had traveled internationally, but I hadn't traveled in places where internet service was questionable, and now I learned a little bit. And that's the lens of what I'm looking through. Okay, so another lens that was created for me was a few years ago. So I have been part of an organization called Global Health Ministries, and Matt has been part of that organization as well. And in the course of working with that organization, I was asked to go down to Tanzania and evaluate some clinics down in Tanzania. They were owned by a hospital and they were supported by a church down in Rochester, Minnesota, but they were having trouble figuring out what did these clinics need? What would be of most benefit to these clinics? Because they were trying to do it from afar and they had had a few disasters. So I said, absolutely, because I understand clinics, that's what I do. So I went down there and it was a fantastic experience. It added to who I am as a healthcare provider. It added to what I can think about as I'm solving problems. So one of the things that has stuck with me so significantly, one of the challenges they have, and they call these dispensaries, they're a lot like clinics, but not exactly. One of the things they have is managing of their medical records. Now here, we typically have a computer system and people use their names and addresses and birth dates in order to do that. But like my experience in Santo Domingo, they don't necessarily have computers, they don't necessarily have internet service, so how do they do it? Well, it varied. There were these 12 dispensaries, some of which had earthquake damage, some of which had no electricity whatsoever. They were in great variation and solving the problems differently in each of those locations. So in this one location, what they had done is they had taken pieces of thin cardboard, more like the cover of a notebook kind of thing, and they had written numbers on them. And they had given them to their patients, these numbers. And it corresponded. And then they had, are you familiar with what blue books are? They're the test books kind of thing, or small notebooks. They had a whole bunch of those in the clinic, and they would write the corresponding number on that blue book, if you will. So the patients would keep these numbers. When they'd come into the clinic, they'd hand it to the staff, and the staff could pull the blue book. Voila, it worked perfectly. The lens that I was taking with me is that you don't have to be complicated to solve the problem. Sometimes the simplest solutions are the best solutions. So in my work today in neurosurgery, I bring that forward. I bring the lens of looking at problems from the fact that there isn't one path for people. I took the path of North Hennepin to Augsburg, to the university, to Capella. That was my path. Other people will take a different path, and that is okay. I take the path, and my lens also brings the perspective that if you have a good foundation, you are going to be able to solve problems and you're going to be able to move forward. Additionally, don't always look for the most complicated solution. Sometimes the simplest ones are the best. And you have to take a risk. We have to take risks. That's how we get to where we're going to go, because it may not always turn out. Santo Domingo didn't turn out. But I learned a lot. She learned a lot. And we're taking that into our next problem. I'm going to ask about internet access next time I have to deal with an employee who may be in a country of which I'm unfamiliar. That's probably a good idea. So I'm bringing this to you today just as my path. All of yours will be different. I encourage you to be bold. I encourage you to see the world through your lens and bring that to leadership, and most importantly, to take a risk. Thank you.